Welcome everybody. I'm Ranjit Kail. I'm Director of Communications at South West London and St George's Mental Health Trust. We're absolutely delighted that you've joined our summit, and it's going to be an incredible event. We've got lots of people prepared in the lineup. We had over 500 people register for the event, which demonstrates the importance of mental health, especially at a time of Covid-19. We're really pleased to have colleagues across the whole of South West London joining us. I can see many of you on the screen, so that's wonderful to see you. We've also got people from Health Watch, councils, faith and community groups, as well as members of the public. And it's wonderful to be bringing this event to you as a partnership. Please do keep your microphone to mute. Please keep your camera on if you're happy to do so. We will be recording the event and the breakout sessions. You would have selected your breakout session when you registered, but don't worry if you haven't or that didn't work for you. We will allocate you automatically. It's really important for us that this event is as interactive as possible. So during the breakout sessions, you'll be able to use the chat function to ask the panelists any questions that you want, and we'll do our very best to be able to make sure those questions are put to the panelists. Now, we're using technology, and we all know how technology can be. Sometimes it's wonderful and sometimes it's not so wonderful, but we're hoping everything goes smoothly. But if something goes wrong with the broadcast, please don't worry. If you just leave the meeting, maybe make yourself a cup of tea and then join us again on the same link within 5 minutes. We'll still be waiting here for you. All the videos and updates will be published later on the week, and they'll be available on that website address that you can see there, which is www.swlstg.nhs.uk. Now, we've got some deaf people that are joining us at this summit, which is wonderful. And we want to say a big welcome. We have British Sign Language interpreters available, and you can find the BSL interpreters who are joining us today by following the steps that I'm about to take you through at the moment, and that are on your screen. So if you go to the gallery view in the top right, you can click on a participant and you can search for the name interpreter 1, 2 and 3. And then you can pin them to your screen using the options for the 3 little buttons that you'll have, 3 little dots, and then you can pin them as it's shown in the image. The other way that you can do this is you can go to the bottom of your screen where it says participants, and you can search for the names interpreter, and you'll see interpreter 1, 2 and 3 pop up, and then you can pin them in that way. So we really want this event to be inclusive. We really want you to get involved and make it as interactive as possible. So it falls to me to now hand over to Anne Beasley, our chair of South West London and St George's Mental Health Trust, who will formally open the summit.
Am I unmuted? Always a good start. Good afternoon and welcome everybody. It's a real pleasure that so many of you could join us. As Ranjit was saying, over 500 people have registered to join us today. So why are we holding this summit? We know that at a time when things appear to be returning to some sense of normality, that many people will still be struggling to deal with the impact of COVID-19 and lockdown. And our summit today is an opportunity for us to discuss the mental health impact that COVID-19 has had and will continue to have on our communities. We know that there are risks to our community's mental health through isolation, through loneliness, financial concerns and loss of employment, and of course, through bereavement. We also know that COVID-19 is having and has had and continues to have a disproportionate impact on our Black, Asian and minority ethnic communities. We recognise that there will be a profound psychological fallout from COVID-19, and we are hosting this summit to understand how we can work together with our partners to address the significant challenges that we will be facing over the coming months and years. We know that an issue this big cannot be tackled by one organisation alone. No one organisation can address all the issues this pandemic has and will continue to throw at us. I'm therefore so pleased that when we first discussed the idea of a summit, we were inundated by colleagues across the system and throughout our communities who heard our rallying call and came to help. We've a great selection of panel members, including representatives from local councils, the NHS, Health Watch, local schools, and local community groups. I'm particularly pleased and grateful to the experts by experience who are sharing their stories of mental health during COVID-19 and the impact it has had on their and their loved ones' mental health. A really exciting agenda. Without further ado, I would like to introduce and hand over to Millie Banerjee. Millie is chair of the South West London Integrated Care System, and she's also a champion of mental health. Millie.
Okay, I think I'm unmuted now. And thank you very much indeed for the warm welcome. I'm very privileged to be here. I'm just checking, can you actually hear me? Yeah, okay, good. So I'm very privileged to be here because, as you said, I'm deeply interested in mental health. We all can guess the effect that COVID is having on ourselves, our families, and our communities. But actually, if we think about it, as you said, Anne, it's much more profound than anything that's happened before. Some of us are old enough to remember the previous recessions, 1990 and 2008. This feels a lot worse. This feels a lot more targeted and a lot deeper, and it's going to last a lot longer. And we all know that we enter this with a deficit of investment in mental health. Let's not beat about the bush. There's been a deficit for a long time. So the challenge is even more large and even more profound. We all worry about people we know. We know, for instance, how isolated the elderly feel. Which one of us don't feel a tightening of our jaws when we call our elderly relatives and ask them how they are? Because isolation and loneliness is terrible when you're old. It's absolutely terrible. It takes away that very important stimulus. And actually, you can see and hear depression setting in. We all worry about children. I really worry that we are bringing up a whole load of children who are frightened of going out, who are frightened of hugging, touching, who are frightened of strangers. And as we know from other experiences, such as childhood sexual abuse, these effects last a very long time, perhaps a lifetime, actually. So we stand here waiting, actually, to understand the full impact of these last 3 months and the continued impact. So those of us who are in some way involved in doing things, making things happen, should rightly feel a profound sense of responsibility. And I do, I assure you, I do. And I just wanted to end with saying, reminding or telling you the story of when I first went to work in a mental health trust. I was on the board of a mental health trust for 6 years, and I didn't go there because I knew anything about mental health. I went there because I knew a lot about technology and I could read balance sheets. So I knew nothing about mental health, actually. So I set about understanding what it was about by talking to people who were practitioners and people who were service users. And I remember, as I began to understand it, a very wise person said to me, you know, you can only help me, Millie, if you understand that it is okay to feel unstable. People like you probably don't, he said, looking me straight in the eye. It is okay to feel disassociated. It is okay to want to hide away. It's okay not to be okay. This is an illness. I didn't bring it about through choice. It's not a personal choice. It's not a failure. And you need to understand that. But he also said to me kindly, because by this stage I was looking horrified and shell-shocked, as you can imagine. But he said to me very kindly, that what we need to do is to talk about it. We need that honesty, we need that sunshine, we need that candor. And if we can do that, then there is hope that together we can find our way forward. So I was really pleased to see the agenda today, because I think that's what we can do today, is to talk about it and bring our experiences to bear and understand the implications of it. At the end of the sessions, we will talk again about what happens afterwards. And we do have a plan of coming back later on in the year. And of course, we will ask you how it went for you. So let's start off by promising that we will be honest. Let's be honest, let's be open. I'm certainly expecting to hear that. And that's exactly why I'm here. So thank you very much, Anne and colleagues, for inviting me. I look forward to the afternoon.
Thank you very much for that, Millie. Very heartfelt opening address. And I know many colleagues and people from the community listening will feel that as well. I'm now going to hand over to Vanessa Ford, who's the Acting Chief Executive of South West London and St George's Mental Health NHS Trust.
Thank you, Ranji. I think I'm live now, so I'm gonna go for it. So I'm incredibly how we have worked together as a community and in partnership, whether it's our staff, voluntary sector, our fabulous patients, those that care for them, the faith groups that we work with. During COVID-19, we've come together and we've done something that I think has been really phenomenal. So I wanted to start by saying thank you. I think the fact that we've got 500 people signed up to today demonstrates just how committed we are as a community to making a difference to mental health. And I really hope that it's just the start of us building on that. And we've got an opportunity to impact on this. Anne and Millie have helpfully said much of what I was going to say, which is really good because it means we're all on the same page. COVID-19 has affected every corner of the world internationally and is continuing to do so. And we are still in a pandemic. And it's really important and sometimes quite difficult to remember that with the excitement and the anxiety of lifting lockdown. And 12 weeks ago, I wouldn't even know what lockdown meant. Lockdown in itself has been really significant. I think it's been particularly significant for those people with mental health difficulties. Can you imagine being a young man with the early symptoms of schizophrenia, living with your family and not being able to go out or get respite in the way that you did previously, and knowing that your symptoms that you can't talk about with your family are beginning to exacerbate? Just imagine that. The levels of domestic violence during this time have also increased. The neglect, those people who aren't able to speak up, who aren't able to go out and get help, right the way through to digital poverty. Now, I hadn't anticipated, when we couldn't go to the shops anymore, I immediately picked up my phone, got onto a well-known website, which I won't name now, and ordered what I needed. It hadn't even occurred to me, and I'm fairly good on mental health, being the chief exec of the trust, but it hadn't even occurred to me that some people wouldn't know how to use a shopping app and therefore couldn't get those needs met, couldn't find out what's needed. And then there's the anxiety of moving out of lockdown. Because we've been locked in for so long, for the first time ever, I felt anxious about going for a haircut. I've never felt worried about it before, normally worried about the after effects of the haircut, but never the actual process itself. And actually that makes you feel, I think there's a lot of people who are experiencing higher degrees of anxiety, stress and concern than they have done previously. But the true psychological impact of COVID-19 remains unknown. The early research suggests that it will be significant and potentially over many years. And we have an opportunity through groups like this to really make a difference. COVID-19 has affected different groups in different ways. I'm sure that nobody on this webinar has missed the disproportionate impact and the unacceptable disproportionate impact on our Black and ethnic minority groups. alongside that, Millie touched on the isolation that our older people are feeling and the children. We know that good mental health is linked to good physical health, both of which support positive social and economic outcomes for individuals and society. Nationally, mental health accounts for 1/4 of the total burden on the mental health spend. Poor mental health is strongly associated with social and economic circumstances, poverty, low quality work, unemployment, and housing. It's well documented that the burden of mental health following disasters, including evidence of previous outbreaks. Therefore, it suggests that COVID-19 is going to have a significant impact on our nation's mental health, with the increased exposure to stressors, exacerbated even further due to the loss of coping mechanisms. Millie spoke and Anne spoke about the issue of bereavements, being able to contact your family and friends, being able to have a hug, or being one of those people who are having to shield for long periods of time. Recently, an article was produced which said 2/3 of adults in the UK reported feeling somewhat or very the effects of COVID-19 on their lives, with the most common issues affecting their well-being being concerns about the future, feeling stressed and feeling anxious. With that in mind, the degree to which COVID-19 affects mental health is very apparent. UCL did a COVID-19 social study of 19,000 UK adults, and they monitored mental health symptoms during lockdown, and they found that the anxiety and depression fell in June as lockdown began to lift, but it remained highest in our Black and ethnic minority colleagues, communities, people, our young people, those with low income, those people with diagnosed mental health difficulties, and those people living with children. So the emerging evidence widens the pre-existing inequalities in mental health. And our ambition through this summit, through you working with us, and through the use of the sessions, is to look at these drivers of poor mental health and to think about how we can tackle these together. We have a strong track record of partnership working in South West London, and I'm so proud of that. For example, the work we're doing on the Ethnic Mental Health Improvement Programme, the whole schools approach. And so I am delighted to be joined by so many of you, my colleagues, but it's only going to make a difference if we keep working in partnership. So I would now like to hand you to Phil Moore, who is going to talk a little bit more about his work.
Thank you, Vanessa. My name is Phil Moore. I am a GP by background, and I do a lot around mental health across South West London. And I think what our challenge is for South West London is, how do we take a really targeted approach to focus on those who are most differentially affected by COVID-19? I don't know if any of you have seen the Centre for Mental Health briefing from July this month, looking at which groups of people will have their mental health that has been affected or will be differentially affected by COVID-19. Some of these we're already well aware of. For example, Black and minority ethnic communities. We also know that poor and deprived communities are much more affected in terms of their mental health. Children and young people generally have been very badly affected. As we know, there's been a huge increase in children phoning the child line. There's been an increase in family abuse, domestic abuse, but equally those who are returning to school may be finding anxieties around that. And there are a lot of young people who are just getting to the end of their college or university careers who are looking for work, who are in a really difficult situation because it's very difficult to find jobs in the current environment. Another thing we need to consider is those who have been through COVID-19 and have had treatment for it or have been in ICU because of it. those who've been bereaved during the lockdown and haven't been able to say goodbye to relatives properly, those who've given birth during lockdown, and grandparents who haven't been able to see their grandchildren, care workers who've been involved in looking after people and seeing loss like they would never have seen before. People with long-term conditions who've not been seeking help and perhaps have delayed getting the kind of help that they really need. And perhaps a group you haven't thought about, and that's the criminal justice system, where people in prison are differentially affected by the effects of COVID. And while there have been actions taken within prisons, it's often increased isolation and will have worsened mental health problems. So my question is, what are we already doing and what's still to be done in Southwest London to try and make this situation better so that people with mental health challenges as a result of this crisis are able to get help? First of all, there is a mental health recovery cell that Vanessa is leading along with Tonya Michaelides, one of the borough managers, to make sure services are in place for everyone so that we are not in a situation where there are gaps in services that people aren't able to get the help that they need. To the Trust's credit, it has put in place a 24/7 mental health support line, which people can phone. Anybody can phone it at any time for help and support with a mental health need. And you can get that number. It's 0800 028 8000. That's 0800 028 8000. Very simple to remember and to phone. The Trust have put in place an orchid crisis can go without having to go to somewhere like accident and emergency, and it's a much better environment for them to be seen in. And that's been a really good service, and that's the kind of the safety net for people who are getting into a crisis. However, there's other work that's already going on. We've got a brilliant schools trailblazer across Southwest London, where schools are looking at mental health and mental well-being, and teachers are having training and learning how to support children and to refer them to the right places. That is going to be very important in preventing children falling into further mental health difficulties and picking them up if they are struggling. We've got 2 trailblazer projects going on around suicide prevention, particularly in mental health in middle-aged men, and in suicide postvention, that is, talking to those who've been bereaved by suicide so that they can get the help and support that they need. So that's in place already. But we've got to do a lot more to take an increasingly proactive and preventive approach and to learn what it is to really intervene early in people who are getting into difficulties. And that means we've got to be very universal in our approach to how we do this. IAPT, the increasing access to psychological therapies services, are going to be very active. They're looking at how to manage a backlog that has arisen through the crisis and how to manage an increase of referrals that is predicted to be anywhere up to 20 or 30% increase. That's quite a load to deal with, but there is a lot of work going on to say, how can we do that successfully so that people don't miss out on the help that they need? A lot of work going on to increase the digital resources, that is for people to be seen and to be talked to virtually through video or telephone or even on email. It won't be the whole answer for everybody, but it will have a key role in helping to meet the needs. There's another bit that we've got to look at, and that's the role of primary care in ensuring that we've got good preventive services in place. And we are learning how to engage more to provide a system-wide approach for everyone at all levels of need so that they can get the appropriate help. And we're looking at mental health in primary care networks. How do we get social prescribers fully educated about what is available for people who are beginning to get low-level mental health needs? How do we get mental health workers engaged within primary care with community services around them so that they can meet the needs of people who are struggling? We've got a meeting coming up in early September where we're getting the primary care network clinical directors and mental health clinicians meeting together to look at how mental health can fully integrate with primary care networks and around them so that the needs can be met and people can be handled well and in a way that will suit them. We're learning how to get together with people with lived experience who know what the system is like and where it falls down and what they need to do so that we can work with them to get better at prevention and early intervention. We're learning to work with voluntary groups because without them, we're not going to have enough resources so that we can get them working together with us. And all of this is summed up very well in the community framework that we're looking to introduce within the whole of South West London. It's a national framework, but it's one that we're trying to make sure works very effectively in South West London. And the whole essence of this is, can we target those with most likely need as a result of COVID-19 so that we can get them back to well-being and to being effective within their communities, able to work, able to get into jobs, and not disabled by their mental health problems as soon as we are able to. Those are some of the things we are doing. There's a lot more to do, but we are making a start with that and making progress as we go along. And I'm going to hand you back now to Ranjit to introduce our next speakers. Thank you, Ranjit.
Dr. Phil and Vanessa, thank you so much for giving us such an in-depth update in such a short period of time. And we're very grateful for understanding what the issues are happening at a national level, but also what's happening at a local level. And there is much for us to get involved and see. So I'm going to hand over now to Stephanie Morris from Rains Park High, who's going to talk a little bit about working together to tackle this crisis and Stephanie's experiences of COVID-19. Stephanie, over to you.
Hello everyone, I'm Stephanie, as I said before. I'm the mental health lead and wellbeing coordinator at Rains Park High in Merton, and we are part of Merton Citizens. In my spare time, I'm also a counsellor at the Wimbledon Guild. So I just want to start by saying how I'm really glad that I'm part of this great moment of opportunity where we're seeing a huge spread in people struggling with their mental health, and just for all of us to come together and work collaboratively. There's a wealth of experience from everyone involved in today's summit, and I hope this will further community connections, challenge our thinking and open our minds when we are thinking about mental health during COVID and what is going on. As we all know, community organisations play an important role, seen throughout the pandemic, of creating a sense of solidarity and voicing the feelings and thoughts of those that cannot be heard due to whatever struggles they are going through. So I'm excited to hear from everyone to better my understanding and deepen my insight into what we feel the community needs from the NHS, and to make sense of what the priorities are right now, and hear some new innovative ideas. I'd like to share my own personal experience of COVID and struggling. And I would say the majority of lockdown, I have felt generally quite positive, and incredibly grateful for the NHS, for key workers, for having a roof over my head, being well, having a strong support network, having a rewarding job, and that's given me a sense of purpose to be able to help others during this difficult time. Ironically, I most struggled with the realisation that despite being able to help others and putting so much in place to do that, my greatest struggle was helping the closest person to me, and that was my mum. So my mum is disabled and she has been furloughed from her job, and she's still furloughed. She lives alone in a flat and she is not great with technology, thrives on being a grandmother, and day to day she copes with being in physical pain. So most of the time you wouldn't know she had a disability, she just gets on with things. But you do get to see a glimpse at times where you realise she can't do things that I would just take for granted, like go for a walk outside, because it would be too much pain for her some days. So growing up, I saw her as somebody that was hugely resilient, like I said, generally gets on with things, but for the first time in my life, I was seeing someone who was mentally very vulnerable, and I began to see her mental well-being deteriorate. I've gained an increased awareness around how the loss of purpose feeling disconnected, experiencing worries of the unknown, and feeling a loss of control over your life can act as a huge barrier for positive mental well-being. And for me, this awareness was sparked when we were having a conversation, and she was expressing that I just didn't understand what she was going through. And, you know, I was trying to reassure her and say, you know, I do understand, like, I understand that it's difficult for you. And she replied to me and she said, no, Steph, you don't understand, because right now I feel like I am just existing and I no longer feel like I'm living. And I think for me, that was just so heartbreaking to hear. And not being able to have that face-to-face interaction, feeling so helpless over the telephone, and not even just being able to just do something simple like give her a hug, really impacted on my own well-being and me, you know, feeling quite helpless to support her. Luckily, as a psychodynamic counsellor, I have therapy. It's part of what you're supposed to do as a psychodynamic counsellor, and I had access to this and via Zoom, and they helped me, they listened to me, and, you know, my therapist empowered me to think about creative ways that I could think in her shoes about what would help her. So just for example, I sent her a puzzle that was in the theme of her favourite band, to, you know, for her to just let her know that I'm caring about her, but also, you know, entertaining her as well and encouraging her to paint again, which is something that she likes to do. And just putting little things in place for her. And I was talking to my friends about this, and when I was talking to them, it became apparent that it wasn't just my mum that was struggling. You know, they had their own stories about their parents, and one of my friends had, her dad had multiple heart attacks but just before lockdown, and he felt very similar. And another one of my friend's mums has just retired, and she again lives on her own, and we was just sharing very similar sort of thoughts and feelings. So when I listened about the experiences also through my work that others were going through, I saw a huge increase in child and adolescent mental health concerns, more and more being raised around anxiety and low mood, and also from parents who just feel lost and, you know, generally just felt unsure of where to turn and how to support their children. So loss has just been a huge theme in my work throughout the pandemic, whether it's the loss of a loved one, the loss of being able to say goodbye, the loss of having a safe space in school, and feeling entrapped in an overcrowded house where, you know, potentially there's stressful situations going on, a loss of identity, a loss of purpose, of jobs, of connection, and the loss of completing important milestones, like for our year 11s and year 13s, completing their exams and celebrating their successes that have taken years for them to achieve. And I could go on, you know, with the amount of losses that there's been for people. And we've been really lucky to be part of the NHS Trailblazer project, to benefit from the support from Merton's Emotional Wellbeing Service and South West London St George's, and from hearing from other schools. And we've had the opportunity throughout the pandemic to still sit down, have cluster meetings via Microsoft Teams, and share our COVID journeys as schools, share ideas and influence services that need to be funded and that are being provided to support the need that's being reflected in our schools. So, you know, it facilitated our ability to also be able to reach out to families. Our education wellbeing practitioners have been able to offer one-to-one support and workshops for parents as well. And they have been sending over an abundance of fantastic resources that we've been promoting as a school, and I've received really positive feedback from parents about these, and also from staff, as they sent over some staff wellbeing resources as well. And they've just been a listening ear, and they've just been there to provide guidance, which has been really reassuring. And I would just like to see, personally, the development of the Trailblazer project to be rolled out to all schools. And another pilot project that I recently became aware of was the 16 plus self-referrals to CAMHS, and that is something that I would also like to see extended, as I'm aware it's coming to an end, and think it could be really relevant right now. So as a school, you know, we've had to think creatively about how we reach out to hard to reach families as well. And for example, we created the community box project, where families came in that were struggling and they could collect food parcels from us. And that's just been a really nice way for us to be able to talk to families, to catch up with them, to just make sure that everything's okay, and just giving us that opportunity to build relationships which we might not have had before in a normal school setting. And that's been great for us to be able to signpost and support families. We've done lots, but I've seen and heard so many positive stories about how community has come together to make support more accessible for families, for young people, and for the elderly, which is where I feel there is a huge need. So in our counselling work, we see the clients as the experts of their own experiences. And I think that's also incredibly relevant to communities as well, because community links are experts in supporting and hearing from underrepresented demographics, or from people, like I said earlier, who struggle to have their voices heard. And in turn, you know, identify barriers for accessibility as well. So we're experts in getting to the heart of how the NHS can make positive improvements. I'm really glad that we're all here today, and we can have those informal conversations about building relationships. So, you know, and we've got the NHS who are experts in implementing their support and delivering interventions and treatments, and giving us the tools to improve those suffering with mental health during the pandemic. So I just want to end by saying that today is the opportunity for us to all bring our expertise together, think about how we can make mental health support more accessible, no matter what the level of the need is. And I'm going to hand over to Peter Brearley from Merton Citizens.
Thanks, Stephanie. That was, I think you'll all agree, very powerful to hear that personal story, as well as how it's, you know, affecting so many other people you're working with as well. As Stephanie said, my name's Pete Brearley. I'm the lead organiser for London Citizens, which is an organisation that works together with churches and schools, mosques, synagogues, universities, colleges, charities to make change on issues that people care about. And of course, at the moment, mental health is coming up top when we're talking to local communities in terms of thinking about what needs to be done. I'd like to just thank South West London St George's Mental Health NHS Trust for bringing this both visionary and exciting opportunity together for us to think collaboratively about what we do going forward. It's not often that you see public services being so open in this way to be collaborative, and I think that that's brave and bold. And want to recognise it. I think for all of us that COVID-19 has been an opportunity probably for us to pause and think about our own lives and examine them and look differently at them, examine the way we run and live in terms of society. But it's great to see the Trust also say we need to pause. We can't just keep going on as if nothing's happened. Let's look at ourselves, look at the communities that we're a part of, and ask ourselves, how can we be innovative going forward? So I'd like to thank them for that boldness in doing that. Somebody who I've worked with actually from Hydri Islamic Centre, who was the chair of the Islamic Centre there, is a man called Dr. Safraz Gerard, who's a clinical psychologist. And I was meeting him for a coffee one afternoon. And as he walked away from another one of his jobs, having been speaking to somebody one-to-one, he looked at me and he said, I keep meeting the same patients over and over again. He said, and I'm really worried that they think they can just get better by seeing me. He said, you cannot get well on your own. You see, the role that communities play in mental health is enormous, as those of you who are on the call, part of kind of charitable community organisations will know. We need community, we need connections, and we need others to be well and to stay well. And I think it's pretty obvious to say, but our communities have played a vital role in keeping people connected during the pandemic. I've heard stories of organisations running community phone trees where somebody's encouraged to call 5 people and somebody else is encouraged to do the same to ensure that people are staying connected with one another. We heard earlier from Vanessa about the problem of tackling digital exclusion, and we've seen communities really lean into that problem and ask, what can we do? And we've seen mutual aid groups step into that space and provide laptops and things like that for people, which has been amazing. I've also seen young people kind of step up, and I've one situation where a bunch of young people said, well, what can we do? And what they realized, that the skill that they had was being able to use technology. So they were connected with a bunch of older people who had no clue how to use Zoom, to teach them how to use it so they could continue to connect with their own community. If it's true to say that we can't get well on our own, it's also true to say that we can't expect one institution or one organization to help people stay well or be well. It's not just the job of the NHS, the job of the NHS Mental Health Trust, the job of our local schools, local faith organisations, or even our local council. As has been said by several people, we are stronger when we work together. And I hope all of our vision is for a community approach to wellness, a whole community approach. We heard someone talk about kind of whole school approach, but actually what I'm interested in is a whole community approach to wellness. How does the school and the GP practice and the local council and the local charity, the local mosque, how do we all work together to think collectively about mental health and well-being of people in our communities? We all know, as Millie reminded us, that there has been a massive deficit in terms of funding the mental health sector. And indeed, London Citizens is part of Citizens UK. We've got a meeting later this week with a senior member of government to make this case about the importance of funding our mental health trusts. And we absolutely need to make an argument for parity of esteem, you know, the importance of both mental and physical health. But actually, with all the funding in the world, if you don't have a strong and resilient community, then the demand will outstrip the resources that we have. So we've got to start looking at prevention. You've all heard the story, I'm sure, of the stream. People know that story of kind of somebody notices that there's somebody drowning in the stream, and they pull them out of the river. And then there's another person. Before you know it, there's a whole team of people dragging people out the stream until eventually some bright spark comes along and says, it's great what we're doing, saving all these people from the stream, but has anyone thought to go upstream and figure out who's pushing them in the first place? And I think when it comes to mental health, we've got to go upstream and think about what are some of the causes and how do we tackle some of those? And we should each be asking ourselves, I suppose my role is for us to say, what is it that you can do? You know, and we can all play a part, we can all have a role in doing this. What's the role that I can play or my sector can play that nobody else can? Because if we each aspire and innovate collectively, what we can achieve is so much more. What can our local councils do to reduce the burden of people? I heard an idea coming out of the Brent Poverty Commission about 0% interest loans because of the number of people that are going to be struggling financially with debt. How can we use our public health budget better to invest in communities to maximise their reach in any preventative work that we're doing? We heard about the excellent work of the Trailblazer that I know Phil has been involved in, and Dr. Andrew Murray has spearheaded with Stephen Allen Brittis as well, who's on this call, which is brilliant. But as Steph said, how do we build on this and make sure it's something that continues into the future? And those of us from the community sector, how do we build on and strengthen the spirit of volunteerism this crisis has produced in the short term and turn it into something positive for the future in terms of mental health? I would love to see an army of mental health champions coming out of this recognition that mental health is such an important issue. It's important that the ideas as well as the solutions that we have are co-produced. One of our mantras at Citizens is people before program. How do we develop people-powered and people-shaped solutions and involve, as Stephanie says, those affected by it, because those affected by the issues are indeed the experts. And I'll finish because I sense two things from those that have spoken. One is a sense of anger at the injustices that we see, but the other is a sense of hope. And I want us to focus both on that sense of anger to move us into action, but also the sense of hope that can help us bring about a better world. Ranjit, over to you.
Pete and Stephanie, thank you so much for giving us such an insight into how COVID has impacted you and the communities that you've been working with. And we're very grateful for hearing from you. And I think I'm sure others will agree. I think you've certainly set our minds racing in terms of what we need to do, and the discussions you were saying about what do we need to do upstream is hugely important to our work today. So I'm going to, before I introduce the breakout sessions, I'm just going to introduce something slightly new to the agenda, which is I'm going to remind people about looking after their own mental health and well-being. And sometimes it's easy to forget that when we're in this new world of using virtual technology. So we're going to introduce a very short 10-minute health and well-being break for people to put the kettle on, make a cup of tea, just have a quick break, and we will see you back here in 10 minutes. But please do think about what you've heard, because we really, really want you to be as engaging and as engaged as possible in the breakout session. It's really important. The richness will come out of discussions and the questions that you asked and put to the panelists. So we will see you back here in just under 10 minutes. So that should be at 3:56. Hello everybody, we're going to be starting in the next few moments, so just to ask you to come back. Thank you very much for taking the time to reflect on the discussions that we had earlier on. Some very important, thoughtful points that were made, and much for us to take forward into the breakout sessions. So I'm going to now introduce the breakout sessions. Thank you very much everybody for registering. We've got 4 breakout sessions: COVID-19 and BME communities, COVID-19 mental health and community resilience, COVID-19 mental health and children and young people, COVID-19 mental health and the impact of the economy. We've been inundated by lots of people signing up, which is fantastic. But we're unfortunately going to have to move some of the people who've registered to other breakout rooms because some rooms are at capacity. So please do bear with us on that. Like I said earlier on, we really want this to be an interactive and engaging session. So please use the chat function to ask as many questions as you possibly can and want to, and the panel will do their very best to answer as many as they can. And we've only got a limited amount of time, so they will do their best. And we're hoping to stick to within 35 to 45 minutes for our breakout sessions. When you go into your breakout sessions, you will be greeted by a host who will welcome you and also introduce the panelists. And you will also hear from an expert by experience who will share their story about that particular subject. So I really hope that you find it useful and engaging, and please do take part by asking questions through the chat function. In a moment, we're going to head over into the breakout sessions and a pop-up box will appear, and what I'll do is ask you to click that box, and then we will automatically go into the breakout session. And when the time is right for the breakout session to end, you'll be asked again to click an icon which will bring you back into the main session. And we've got a huge amount of conversations to hear about after the plenary as well, so we're really looking forward to welcoming you back. So in a moment you'll see a pop-up that will come up and it will take you through to one of the rooms. We're sorry if you haven't got the choice that you registered for, but that just allows us to be balanced across the other breakout sessions. So we'll join you again very shortly and see you in the breakout sessions. Please click the icon.